Most Distinguished Athletic Trainer in 2009. So again, my plug for the textbooks. You co-wrote this textbook, Therapeutic Modalities, added to your Trinity. Let's welcome Dr. Dexter.
Thank you very much. This has been one of the best seminars I've been to before, because these two guys here, this is incredible. I have had their textbooks for years. I talked with Dr. Bellew over in Brazil a couple of years ago and became a big fan of him. And I've had all of his textbooks since I was young. And it's just amazing. I've always thought this shockwave therapy would be neat. And now we have to go home and buy one at BYU. So thank you, Cougars, for being here. How many are Mount Royal Cougars? Raise your hands. I'm a Cougar too, Brigham Young University Cougars. And we both have blues, so that's a good sign. Today I'm going to talk to you about something that's been around a long time, and that's ultrasound. But I'm also going to share with you a new type of ultrasound that I don't think anyone in Canada has heard about yet. In fact, probably only 1% of the athletic trainers in the U.S. know about this sustained acoustic medicine that I'm going to talk about. So we'll kind of start with the old and how to improve the old, and then bring in some of the new. Now, I have a ultrasound. This was in Brazil. And we're going there again in October. And they took us in a factory that made modalities. And that's like taking a kid into Toys R Us for me. Because I'm a modalities geek. And I saw this bucket full of ultrasound heads. And I said, I've got to get a picture of that. So I love ultrasound. It's my favorite modality, and it's used an awful lot in the country and throughout the world. I thought we would start with a little bit of a quiz. I see out there you're studying for finals. Right now my students are taking a final exam in Provo, Utah, so you can't get off the hook. So write down number 1 to 15, and we'll see how well you do now, and we'll review this at the end of the presentation. So question number 1. Which of the following would respond best to a 3 megahertz ultrasound treatment? A, subacromial bursitis. B, lateral epicondylitis. C, soleus strain, and D, piriformis syndrome. So what would be the best for that frequency? Go ahead and jot down the answer, and Dr. Valdez will be buying you a brand new Porsche for whoever wins. Question number 2. Which of the following would respond best to a 1 megahertz ultrasound treatment? A, medial epicondylitis. B, long head of the biceps tendinitis. C, patellar tendinitis. D, quad strain. And I'll give you a hint, it's a deep quad strain. There are superficial ones. Okay, number 3. Which ultrasound frequency heats the fastest? Which ultrasound frequency heats the fastest? Is it A, 1 megahertz, B, 2 megahertz, C, 3 megahertz, or D, 90 kilohertz? Number 4, which structure heats the fastest? Is it A, tendon? Is it B, ligament? Is it C, muscle? Is it D, fat? Number 5, what is the appropriate treatment size for thermal ultrasound? Blank times the size of the sound head. Is it A, 2 times the size of the sound head, B 4 times, C 6 times, D 8 times the size of the sound head, or E none of the above. Question 6. Ultrasound is most effective when moved at a speed of what distance per second? Is it A 4 centimeters per second? Is it B 6 centimeters per second? Is it C 8 centimeters? Is it D 10? Or speed of sound head movement is not a factor with ultrasound. Question 7. The acronym ERA refers to A, the type of tissue being treated, B, percent of the crystal that is transmitting the beam, C, the duty cycle, D, the energy produced by the crystal, and E, 2 of the above. Number 8, driving medication into the tissues via ultrasound is known as A, attenuation, B, iontophoresis, C, phonophoresis, D, none of the above. Number 9, which of the following are contraindications for ultrasound use? A, sprains, B, strains, C, over implanted metal, D, cardiac pacemaker, E, 2 of the above. Number 10, raising the muscle temperature to about 40 degrees Celsius. So if we start at a baseline of 36 degrees Celsius core temperature and raise it up to 40 degrees Celsius, about a 4-degree increase, that is required for what conditions? A, phagocytosis, B, pain relief, C, acute tendinitis, D, muscle spasm relaxation, and E, stretching. Okay, now we have some true and false ones. 11, a measure of ultrasound energy is called a joule. True or false? A measure of ultrasound energy is called a joule. True or false? 12, an ultrasound treatment can be applied for over an hour. True or false? 13, an effective ultrasound treatment should deliver at least 2,250 joules, roughly just over 2,000 joules. Is that true or false? Number 14, ultrasound can be effective into the tissue for up to the size of a baseball. True or false? And last, ultrasound machines are big and bulky, about the size of a laptop computer. Okay, so we'll grade these at the end, and we'll all have 100% at the end. I like history. It was fun listening to Dr. Bellew talk about Yakov Cox, and Dr. Belanger and I last night, we had a nice discussion about Cox, and he was actually working the '76 Olympics in Montreal and learned of Cox work and so forth. Well, there's a little bit of an interesting history with ultrasound too. Prior to World War II, German scientists were experimenting with sonar in submarines. Sound was emitted from the vessel to detect objects in the surrounding water. The scientists noticed that fish were destroyed in the process. Thus, the idea of ultrasound producing biological effects was born. Now, most of the time when you talk to the lay person about ultrasound, they're looking at this. Okay? I'm the proud grandpa of 7 grandchildren. Our 8th is on the way, middle of July. And my daughter showed me the ultrasound. And any of you seen the 3D ultrasounds they do now? Any of you seen those? They're amazing. I mean, it's just amazing how they look. And so the science has really moved along. But what we're talking about here is therapeutic ultrasound, and where like 99% of the time it's used for the thermal effects. Now there's an advantage of ultrasound over other thermal modalities such as whirlpool, hot pack, paraffin, is that structures high in collagen, tendon, ligament, muscle are heated to a vigorous level without overheating the surface. You can put a hot pack on someone and you can burn them. It's very difficult to burn someone with an ultrasound machine. Now at our university, we do a lot of studies where we put temperature probes into the muscles of our students. And then we will do ultrasound to see how much the temperature goes up. We'll put an ice pack on to see how much the temperature goes down. We did this with our students, and we usually pay them 20 American dollars, which is a good 5 meals at Taco Bell. So it's a good bargain for them. But if you notice here, whirlpool, a warm whirlpool at 1 centimeter will raise the temperature 3 degrees Celsius, but at 3 centimeters only about a degree. So it's a superficial heater. The same with hot pack, it's about the same. Paraffin wax at 1 centimeter will raise the temperature about 2 degrees, but it won't raise it at all deeper into the tissues. And if we were to put ultrasound out there, depending on the frequency, ultrasound can raise the temperature 4, maybe even 6 degrees if you use it 3 megahertz at 3 centimeters deep. So the only 2 deep heating modalities that I'm aware of are ultrasound and pulsed shortwave diathermy. Now, how many of you have pulsed shortwave diathermy? Typical. We just don't. But the nice thing, ultrasound, in order for it to be effective, you've got to treat an area 2 times the size of the sound head. When you start getting bigger than that, it doesn't heat very well. Diathermy can heat up an area as big as a diathermy drum, and so I'm on the bandwagon to try to bring diathermy back because we need that deep heating modalities. Now, there are some thermophysiological effects of ultrasound: increased extensibility of collagen fibers, reduced viscosity of fluid elements in the tissues, decreased joint stiffness, reduced muscle spasm, diminished pain perception, increased metabolism, and increased blood flow. Some of the non-thermal effects are wound healing, vascular regeneration, increased phagocytic reaction of the macrophages, increased protein synthesis, tissue regeneration, cell membrane alteration, and increased capillary density of ischemic tissue. There are some contraindications to ultrasound. One would be thermal ultrasound when tissue temperature rises not wanted. So you wouldn't be using thermal ultrasound when you should be using RICEs, rest, ice compression, elevation, and stabilization, because it would just add to the swelling of the area. Areas of lost sensation, you wouldn't be able to tell when it's too high. Areas of decreased circulation. For example, I've got a friend who is diabetic and he has a lack of sensation in his hand. I would not use ultrasound on his hand in the thermal mode, because how blood flow gets to increase with ultrasound is we have homeostasis. We have a set point we're comfortable at. As the tissue starts to raise up too high to where there's a fear that it might damage the tissue, the body sends in blood flow to the area to prevent overheating. So if somebody doesn't have good circulation, thermal ultrasound would be contraindicated because it could actually damage the tissue. Over the eyes, reproductive organs during menstruation, with a pacemaker. But that doesn't mean you can't treat an ankle. I had a neighbor years ago that had sprained her ankle, and it had been a week past the ankle sprain. And I said, why don't I do some ultrasound? She said, stay away from me. I have a pacemaker. Okay. It's pretty well known that you stay away from the general vicinity of the pacemaker. In fact, one company has come out and said stay about 6 inches away. Now they've come out with pacemakers that don't even have any wires. And so you could treat bicipital tendonitis in the left shoulder with ultrasound and be fine if the person had a pacemaker. Malignant tissue, that can cause a tumor to spread. Active infection. Epiphyseal plates is now a precaution. If you look in Jim's book on ultrasound, it says that now they recommend to stay no more than 1 watt per centimeter squared. Okay? The original contraindication was found in laboratory rats where they did ultrasound over epiphyseal plates and they prematurely closed the plates. But they used 3 watts per centimeter squared. That's way too high. Most ultrasound machines won't go that high. Just this past week, I finished treating a 10-year-old girl who had dislocated her elbow 6 months ago. And she's been going in for physical therapy, and the physical therapist used hot pack or used hot whirlpool and stretching and couldn't get her range of motion back. So she came into my lab. I use ultrasound because it'll heat the deep tissues, and I use joint mobilizations to get at that capsule that's inflamed, and was able to restore her range of motion. But I kept the ultrasound machine under 1 watt per centimeter squared, and there was no problems whatsoever with her growth plate. Now, facts and misfits. I was honored a year ago, asked by the European Journal of Physical and Rehabilitation Medicine to write an article for them. Years ago, and I see a smile here by Mark, years ago I came up with an article called The Top 10 Mistakes Clinicians Make When Using Therapeutic Ultrasound. And that's got a lot of press. A lot of people have been interested in that. And he said, let's revisit that. Come up with the facts and misfits of ultrasound. So I came up with 7. So 7 steps to improve treatment outcomes. Treat the correct size area. 2, use the appropriate treatment duration. 3, avoid using preset intensities. 4, use the correct frequency. 5, don't treat all tissues the same. 6, move the sound head at the appropriate speed. And 7, be aware of the stretching window. And Dr. Belanger last night mentioned, be aware of how much subcutaneous tissue they have and how much fat they have in the area. So let's quickly look at each of these. I love this drawing. I worked in the 2002 Winter Olympics in Salt Lake City, worked long track speed skating. And in order to do that, I had to work at a World Cup championship. And so I worked at a World Cup championship in 2001. And I went in to the Canadian, and I love Canada. One of my colleagues is from Canada. I went into a Canadian physiotherapist room where they were treating this world-class speed skater, and they ultrasounded the entire low back. What good did that do? Nothing. That was pure placebo. Okay? So why do we know this? Well, we did a study at BYU some years ago, and we compared an area 2 times the size of a sound head and 6 times the size of a sound head. Our baseline was 36 degrees Celsius. 2 times the size of the sound head, we got an increase of 4 degrees. And this was when we were using 1 megahertz at 1.5 watts per centimeter squared for about 12 minutes or so. 4-degree increase, 2 times the size of the sound head. When we had 6 times the size of the sound head, and that's not very big, folks. Half a degree increase. Ultrasound was made to treat small areas. That's why we need pulse shortwave diathermy. You can buy them for $6,000. That's not that bad. That's US dollars. I don't know what that comes to. My gosh, man, you guys have good gas prices. I saw gas for 97 cents a gallon the other So the recommendation is to treat an area 2 times the size of the center. Okay. Now, you've got a quad stream. You can't do a whole quad with ultrasound. So what I recommend is find out the area that's the sorest, that hurts the most, treat that area. And hopefully that will get a cascade of healing going through the rest of that. Okay, number 2, use the appropriate treatment duration. I travel around the globe doing presentations. I will go back to Utah on Monday, go into the training room, and you'll have all of our staff doing 6-minute treatments. They don't read my stuff. Dr. Bellew knows. You know, we come here, we're treated like kings. We go back here and you go, there's that Draper kid. But you need to have a treatment goal. And so there are some treatment goals here. And so, for example, 3 megahertz heats 3 times faster than 1 megahertz. You got a crystal deforming 3 million times per second here and 1 million times per second here. This is going to heat up 3 times faster. So tissues that are more superficial, you don't have to go as long with. That's where my athletic training staff might be okay if they're doing 3 megahertz, okay, unattended. But if they're going 1 megahertz, that just wouldn't be enough. So when using 1 megahertz in general, whether it's 1 to 2 watts per centimeter squared, your treatment should be 10 to 15 minutes, okay? When using 3 megahertz, it should be 5 to 8 minutes roughly. Now that's if you're using a good machine, and there's a big variability in machines. I don't make money for this company. I do research for them, but they're called Accelerated Care Plus. They're out of Reno, Nevada in the USA. Best ultrasound machine on the planet, in my opinion. And that's going with research that's been done by Don Gulick at Widener University, who is a PhD certified athletic trainer and physical therapist. Dr. Mark Merrick at The Ohio State University, Dr. Bill Holcomb at UNLV, and me. And we've tested probably half a dozen different types of ultrasound machines, and the Accelerated Care Plus machine, the OmniSound by AC Plus, heats a third higher and faster than all the other machines. So the machine does matter. So that's why it's extremely important to use the right parameters. I'm not saying go out there and sell your machine and get a new one. Make sure you use the right parameters and be conservative with those. Number 3, avoid preset intensities. When I went to college in the late 70s, early 80s, everything was 1.5 watts per centimeter squared. Okay? I don't know if they still teach that. But what you should do is go according to patient tolerance, because if I'm doing, here's my ultrasound head, and I'm treating his brain because I want some of that brain, okay? So I'm treating him, okay? If he says that's too hot, I don't say tough. My teacher taught me 1.5. Tough it out. I have to go according to that tolerance, so I turn it down. So what I recommend is kind of a starting place, is because 1 megahertz is deeper structures and heat slower. I recommend start about 1.5 watts per centimeter squared, and 2 minutes into the treatment, ask them how does it feel. If they say it's too hot, turn it down. If they say they can handle more heat, you can turn that up. Okay?
I'm sorry to interrupt you.
Yeah.
I don't normally do this, but we just got a note from the people online. And we have to tether you back over in this general area because they can't hear you. So, I know that's bad.
I get so excited. I want to move around. I'm sorry about that, people online. Okay, very good. So, and with 3 megahertz, what I like to do is start maybe at 1 watt per centimeter squared. A couple of minutes into the treatment, ask them how they feel. And if they say it's too hot, turn it down. If it is too cool, you can turn it up. Now, wouldn't it be, let's think about it for a minute. We want a 4-degree increase. We're going 1.5, and they say that's too hot, turn it down. If we turn it down to 1.0, shouldn't we add on some time? Sure we should. There's only one machine on the planet that does that for you, and that's the OmniSound by Accelerated Care Plus. Has a little computer in it. As you turn the temperature down, it adds on the treatment time before it shuts off. As you turn the temperature up, it decreases the time. It's really neat. It's like ionophoresis. Okay. Number 4, use the correct frequency. 1 megahertz absorbs energy from 2 to 5 centimeters deep, like piriformis syndrome, soleus, rotator cuff, etc. 3 megahertz absorbs energy from the surface to 3 centimeters deep, such as patellar tendonitis, Achilles tendonitis, plantar fascia, IT band, ankle ligaments, gastrocnemius, etc. So make sure you're using the correct frequency. Probably the #1 frequency we use in sports medicine is 3 megahertz, because most of our structures are within those 3 centimeters deep. Don't treat all tissues the same. Tendon, due to its poor blood supply, heats 2 to 3 times faster than muscle. So if you're treating an Achilles tendon, you don't need to go 10 minutes. If you're going 3 megahertz, 5 minutes may be fine. Okay, that's something good to know. So recommendation, treat tendons 2 to 3 less time in minutes than muscle. Number 6, move the sound head at an appropriate speed. A lot of my students go out and they do rotations with athletic trainers at various high schools or physical therapists at clinics. One of the big things they see, well, the big one is treating too big of an area. And then the next one is racing that sound head. Boy, they're just moving really, really fast. Okay? There's a problem with moving it so fast, is if you move it real fast, you start to slip into a larger treatment size. Okay? So I recommend about 4 centimeters per second. Whether you go back and forth or circular strokes, that's fine. This is a medical device. It's not a deep massager and so forth with a lot of pressure. You should use it appropriately at around 4 centimeters per second, 2 times the size of the sound. Number 7, be aware of the stretching window. The number one reason I use ultrasound is to decrease pain. Number 2 is to get range of motion. And I've published a fair number of papers on people who have had frozen wrists and how we were able to get their range of motion back. So let me show you one here. She was in a paper that just came out a year ago. This is a former student of mine, 23-year-old college student who had right wrist triangle fibrocartilage repair and much lunate wear from 6 years of high school and junior high school sports. She was 1 month post-surgery cast. Took her cast off, had very little range of motion. Treatment, 3 megahertz ultrasound to the anterior and posterior wrist for about 5 minutes at 1.4 watts per centimeter squared. The reason I went 1.4 is that's all the higher the machine can go. Otherwise, I would have gone a little bit higher. Then I did 8 to 10 minutes of joint mobilization. So let's look at her pictures here. This is her uninjured wrist in extension. Here's her injured wrist in extension. Has very little extension there. After 5 treatments, the extension is equal. This is her flexion. Her uninjured wrist there, full flexion. Here she's about 45 degrees. She needs to get down to 90 degrees flexion. Here she is after just 5 treatments. Look at this. No radial deviation whatsoever. After 5 treatments, equal radial deviation. Before 5 treatments, had some ulnar deviation, full ulnar deviation after 5 treatments. And I've done this with dozens of people, and it's been so very, very effective. You try it with a hot pack, you try it with Whirlpool, it just won't work. And the key is the joint mobilizations too. Now in the United States, and I think somewhat in Canada, there are purists of the physiotherapists who think all they need are their hands. They just want to do manipulation. Why not heat up a structure before you use your hands? Because by heating it up, you're going to make the tissues more willing to be stretched and moved and so forth. So, don't ignore the stretching window. Basically, from the time you finish that ultrasound treatment until it cools down too much to move it is about 7 to 10 minutes. So you don't have time to check your emails, you don't have time to run to the restroom, you don't have time for a coffee break. Immediately when you're done with that ultrasound treatment, start stretching them or do your joint mobilizations. There are some myths. Ultrasound can be used over metal. I've used it several times, okay? It heats up structures high in collagen. It does not heat up metal. Total knee because of the glue, that's kind of iffy out there. Okay, that's kind of iffy out there. If you were just using ultrasound mainly for a little bit of pain relief and you're maybe going just a half a watt or 1 watt per centimeter squared, you'd probably be fine. But I wouldn't want to do a lot of heating in there for like getting range of motion back. Ultrasound, you can cross the spine with ultrasound. Some people feel you can't cross the spine. And then there's all these menthol-contained lotions. How many of you use BioFreeze as an ultrasound medium? Raise your hands. It's used a lot in the U.S. How many of you use Icy Hot? How many have heard of Icy Hot? We've all heard of Icy Hot. Some people use it as an ultrasound medium. Those are not good mediums, okay? The reason Icy Hot works, and I read a paper on this just the other day, where they put temperature probes in 2 centimeters deep and on the surface, and Icy Hot didn't cool the tissue and then didn't warm it up like Shaquille O'Neal will make you think it did. Just kind of didn't do much at all. But it gives you the sensation of heat or cold because it has menthol. BioFreeze gives you the sensation of cold because it has menthol. Flexol, Blue Emu, all of those things give you the sensation of heat or cold because it has menthol. So I don't mind using those as a couplet, but not at 100%. If I want that good feeling they get from rubbing on that counter irritant, I will use 1 part of the Icy Hot cream with 3 parts of ultrasound gel. So mix it like that. And then you can get the added benefit of the menthol. Okay, a joule is a measure of work or energy. There are several studies that claim ultrasound does not work. There are a lot of meta-analysis out there that just blast ultrasound and say it doesn't work. But as I've read some of the studies, they treated too large of an area, their treatment duration wasn't long enough, and they used the wrong parameters. They used 1 megahertz when they should have used 3 megahertz. There was one study that they took ultrasound and treated the medial joint line of the knee for 3 minutes, then did a valgus force on the knee. It didn't open up any more than normal, and so they said ultrasound doesn't work. That's a stupid study. They're using things like that to pat themselves on the back that all they need are their hands and they don't need ultrasound. So the key is you have to have enough energy delivered for ultrasound to work. A joule is a measure of work or energy. The articles that support the use of ultrasound use the appropriate joules to reach the treatment goals. A joule is a unit of work or energy. Crystal size times the intensity times the time in seconds. So for example, if you had a 5 centimeter squared crystal, which is about the size of an American quarter, and I'm guessing about the size of a loonie, I don't know. So I had one years ago. But that's a typical ultrasound crystal size, okay, 5 centimeters squared. At 1.5 watts per centimeter squared for 10 minutes, you've got 4,500 joules. So that's considered enough energy to get the job done. So here are some studies that all showed ultrasound worked, okay. Downing and Weinstein used 1 megahertz on supraspinatus tendinitis. They did a group of 1 watt per centimeter squared and 2 watts per centimeter squared. The treatment time was nearly 16 minutes. They had anywhere from 4,000 to 8,000 joules. These people got better. Bellew et al. In 1999 used 1 megahertz for calcific tendinitis. Half a watt per centimeter squared, about 15 minutes worth. 2,250 joules, this was effective. Shimano et al. In 2002, 3 megahertz for calcific tendinitis, 1.2 watts per centimeter squared for 6 minutes. That came up to 4,300 joules. these people got better. And the last one, 1 megahertz hip osteoarthritis, 1 watt per centimeter squared for 15 minutes. This was 4,500 joules. These people got better. And if you look in the literature, the studies that say ultrasound doesn't work, they're under 2,000 joules. That's one of the big problems. So, the new type of ultrasound that I'm so excited about, I'm going to come out here and then come back. I met the guy that invented this about 18 months ago. And when he was a PhD student at Cornell University, he attended a thing where they could stand up and in 1 minute talk about something they invented. And basically what he said is, I'm George Lewis, I've invented the smallest ultrasound machine in the world and it's going to change the world. Pretty cool. You know, you got to listen to this though. This is neat. Sustained acoustic medicine, or SAM, delivers up to 18,720 joules per treatment because it is applied for up to 4 hours. Look at the size of that. That's your cell phone right there, folks. Okay? So, this is the ultrasound device. This is the crystal that has a little patch that applies it to the area. It can be worn up to 4 hours. Imagine getting that ultrasound energy for 4 hours. Wouldn't that be neat? Okay? Low intensity. The reason they can deliver it up to 4 hours is because it's 0.132 watts per centimeter squared. It's 100% duty cycle. It is possible to deliver these long-duration, low-intensity treatments because the device is portable, small, about the size of a 10s unit, battery-operated, self-administered, comfortable, worn during the day of course of daily life. So this individual here has a bicep strain. So she's put this sustained acoustic medicine on there. It's very easy to do. You push one button to make sure it's charged. You push another button. Every time you push it, it gives you another hour, up to 4 hours. It's indicated for relief of pain, relief of muscle spasms, and local increase in circulation. This is what the crystal here looks like, and it's the size of a US 25-cent piece. So this is kind of a brick wall here that we run into with several modalities, and this is breaking through the brick wall. It says SAM is sustained acoustic medicine, self-applied for long-duration ultrasound therapy for a treatment of up to 4 hours. Each 4-hour SAM treatment provides 18,000 joules. That's if you use 2 crystals of acoustic energy with an easy-to-apply bandage. It comes in these different wattages here. The main one is 0.132 watts per centimeter squared. 3 megahertz. Now we're coming out with a 1 megahertz device that will go deeper. So here's some studies. They did a study on chronic trapezius myalgia. They had 30 subjects, and actually we participated in this study at BYU. So we recruited 30 people that had pain, had upper trapezius pain. And 15 of them got a device that worked, 15 of them got a placebo. But it was double-blinded. The nice thing about this is we didn't know which was which. Because if I knew, and I said, I really like you people at Mount Royal University, I'm going to give you the device that's going to make you better. But I don't care about the people at the University of Calgary, so I'm going to give them a sham device, okay? I couldn't do that. I couldn't play favorites, because I didn't know what machine was what. All they had is I'd give them a machine, tell them to wear it for 4 weeks, 4 hours a day for 4 weeks, repeat back every week, and we sent the machines back, we sent the data back, then the company tells us who was sham and who was not. And there was about better than a 30% increase in decrease in strength among those who were the device compared to the other. knee osteoarthritis. They did a study on knee osteoarthritis and found this sustained acoustic medicine had a great reduction in pain and better improvement in movement scores and so forth. Now, they hired us to do a study on muscle because they wanted to make sure if you wore this for 3 hours, would it overheat and actually burn the tissues. And so we put temperature probes in 1.5 centimeters deep and 3 centimeters deep into the gastrocnemius muscle, and we did our ultrasound treatments. And as you can see here, we got a temperature increase of over 4 degrees at 1.5 centimeters deep and over 3 degrees at 3 centimeters deep. So that would be good for increasing blood flow, decreasing pain, and so forth. So, these are some quotes from the knee osteoarthritis study. Very, very happy with this device. I hate to think about how I will feel not using it after returning it today. It has greatly improved my quality of life, and I think I'll be lost without it. Will highly recommend it to anyone. Started a new exercise program. Couldn't have done that without Sam. I have seen such great improvement each day. Sam is seriously a miracle for me. I'm almost pain-free. I know I have to give Sam back at the end of the study, but I don't want to. I feel human again. So quite a lot of things after people with osteoarthritis pain. Now this was our pictures that we did for our muscular study on temperature increase. This temperature probe in here is 1.5 centimeters deep. This is 3 centimeters deep. We are the only university I'm aware of in the States that then uses imaging ultrasound to see how deep those probes actually are. See, we measure down and then we put the probe in and hope we're 3 centimeters deep, but this will tell us that maybe we're at 2.8 or whatever. And on average, we are only a tenth away on the depth. This is showing then the 2 crystals being applied, so the 2 crystals it can treat an area up to the size of a baseball. Past research and review then studies on knee osteoarthritis, shoulder tendonitis, and trapezius muscle spasm have all found the SAM to be effective in substantially decreasing pain. And a study at BYU found that the SAM produces moderate to vigorous heating in human muscle. So, astronauts are interested in this because when astronauts go up to space, they become weightless. And they actually gain about 2 inches in height. And a lot of that has to do with the disk space. So when they come back and gravity hits, they're at a great propensity to rupture a disk. So it's kind of interesting. We received a grant from NASA for $250,000 US to study back pain. And so one of my former doctoral students, who's a professor about an hour from me, is going to collect 25 subjects, and I'm going to collect 25. And they have to be between the ages of 20 and 60. They have to have a herniated lumbar disc. They have to be willing to go off pain meds, and that might be a little bit of a problem, but we're going to try to do the best we can. On a visual analog pain scale of 0 to 10, they have to be at least a 4, 5 days out of the week. So they wear this device for 8 weeks, at least 5 days a week for 8 weeks. We take pain scores every week with them. We take what's called the Oswestry scale that measures movement and activities every week. We also have them wear what's called an actigraph that measures motion. And so people with back pain, anyone in here ever herniated a disc, or am I the only one? You don't sleep quite as well, okay? And this will measure how many minutes they actually sleep during the night, how many times they wake up. So the theory is that after using this SAM device, this sustained acoustic medicine, they will sleep better at night. So it's going to be a fun study. We're really excited about it, and we're doing our pilot study now to collect some of the data. So who's using SAM? These are some pretty popular people in the United States. Kevin Wilk who's with Champion Sports Medicine. I'm sure Jim knows who he is. Claude Mormon, MD, he's at Duke University, and Duke just won the national championship in basketball in the U.S. We have Tom Best, who's an MD, PhD at Ohio State, and then this picture, 15 years old. So I look much better there. We're using this at BYU. Now, so ultrasound benefits. Ultrasound in general. Reduced pain, reduced inflammation, increased healing rate, non-invasive, and a simple treatment. Traditional is a large size. It's about the size of a laptop computer. Cost could be anywhere from $1,000 to $2,500. Okay? Not portable. Treatment time 5 to 15 minutes. Applied by a clinician, and there's messy gel. But this wearable solution, this SAM, there's no mess. It has a little hydrogel, so it's kind of like a gel shot. It's very, very handy. You use it daily while you're sitting home relaxing. You can wear it while you're exercising if you want. And it's long-lasting and battery-powered. So will SAM ultrasound replace traditional ultrasound? No, no. You're not going to have someone come in your athletic therapy room and hook them up to this device, because they'd have to be there at least an hour, maybe up to 4 hours. But you could send them home with it. We have some we're using with our football team at BYU. It's great when they're on the plane flying back east somewhere to play some team. It's great when they're at the hotel room. It's great for after practice. They can wear it home with them while they're studying and so forth. And so that's where it's going to come in very, very handy. So traditional ultrasound lasts from 5 to 15 minutes, requires constant monitoring by a clinician, can reach the therapeutic level in 5 to 10 minutes, comes in both 1 and 3 megahertz, and is 0.1 to 2.5 watts per centimeter squared. You can use pulsed or continuous mode. Whereas this sustained acoustic energy is a very low intensity, long duration, 2 to 4 hours, static application, little monitoring by the clinician, takes about 30 minutes to reach the therapeutic level, but then it maintains that throughout the treatment. Comes in both 1 megahertz and its continuous mode. So I think of SAM as another tool for clinicians to use. We not only have traditional ultrasound in the athletic therapy clinic, but we also have the sustained acoustic medicine they can take home with them. So there's the picture of it. Very, very handy little device. Okay, hopefully this will work.
Tissue remodeling is a complex physiological response that occurs after an injury. Natural limitations to this process often lead to mechanically inferior tissue, adhesions, and chronic pain conditions, especially in tendons which have limited blood and nutrient supply. Sustained acoustic medicine, or SAM, is a new wearable technology that utilizes mechanical ultrasound waves to promote the healing cascade. Different from traditional ultrasound, SAM applies a mild mechanical stimulation to the tissue over multiple hours, providing enhanced recovery benefits. SAM's continuous ultrasound waves produce a convective flow called acoustic streaming up to 5 centimeters into tissue. Combined with an increase in heat and circulation, the sustained mechanical pressure increases the bulk flow, pumping nutrients and growth factors throughout damaged areas, enhancing natural healing. When SAM is applied, the mechanical forces activate cell membrane receptors, enhancing cellular proliferation. One important mechanism is the upregulation of transforming growth factor beta, which increases type 1 and type 3 collagen deposition and promotes native tissue regeneration. The result is greater tensile strength and improved biomechanical properties of the tendon. Sustained acoustic medicine, SAM.
So So I think you could see that person with lateral epicondylitis could, just as one little example, derive a lot of benefit from this particular modality. Okay, let's get back to our quiz. See how we did. Anyone take the Sport 15? You're off the hook. You don't have to give away a new car. All right. Lateral epicondylitis. Why? It's the most superficial. The others are too deep. Okay. Quad strain. Why? Because 1 megahertz goes basically from about 2, most of the energy is absorbed from 2 centimeters to 5 centimeters deep, so we get those deeper areas. Number 3, frequency that heats the fastest is 3 megahertz. Probably the one that goes the deepest is 90 kilohertz. We don't know how deep that goes yet. I haven't heard that it's been measured anywhere. Number 4, which structure heats the fastest? The tendon, because of the lack of blood flow. Appropriate treatment size for thermal ultrasound, 2 times the size of the sound. Ultrasound is most effective when moved at a speed of what distance per second? 4 centimeters per second. The acronym ERA, I love those questions that say 2 of the above as a choice. My students hate them. But it really tests your critical thinking. Because you kind of look at this and go, yeah, B looks good, but gee, D looks good too. So why don't 2 of the above? It's percent of the crystal that is transmitting the beam. Phonophoresis, probably most of you got that one correct. Cardiac pacemaker, probably many of you put 2 of the above, but it can be used over metal. It will not heat up metal. Stretching, main thing there. 11, a measure of ultrasound energy is called a joule. That is true. An ultrasound treatment can be applied for over an hour. That is true. An effective ultrasound treatment should deliver at least 2,250 joules, roughly in that area, is true. Ultrasound can be effective in the tissue for up to the size of a baseball if you're using the correct parameters. That would be true. Ultrasound machines are big and bulky, not anymore. And the cost is about $700 US, and that's not too bad for a nice medical device like that. And if any of you work in a clinic setting, you can rent those to the patients. And in the US right now, workers' compensation is paying for them. I don't know how that would work in Canada. But we've got some professional soccer players that have tendonitis. We're going to use SAM on them, and their insurance will pay for it because they're workers. That's what they do, is they play professional soccer. So it's kind of fun. Well, thank you very much for another shameless plug for my book.
I'd like to thank David for a wonderful presentation once again. We'll have Mark do maybe 5 minutes of a Q&A facilitation, and then we'll take another break. And then we'll move into a wide open Q&A for the rest of the event. So, I hand over to Mark. Okay, we don't have any online questions, so.
So you had mentioned that they're thinking of increasing the megahertz on the SAM, because it's very low right now. What would that do in terms of standing wave? Because the sound's not moving.
I think because the intensity is so, I have to come back here. Because the intensity is so low, I don't think it's going to be any problems there with the standing waves causing any kind of damage.
Did you say it was available in Canada or not?
Well, I'll give you the website and they'll send it to you.
Very good.
It's just called ZTROZ. Just Google ZTROZ, Z-E-T-R-O-Z. Z-E-T-R-O-Z.
And that's Z in
That's Z in Canada?
I should mention too, I'll get you in a second. So off often Larry has done this for me where they have medical devices in the US, but they haven't gone through Health Canada yet. So Larry's been able to work his magic. So, and then do you end up contacting Health Canada there?
Yeah.
Yeah, and then putting it on their watch list. And so I don't know if you have anything to comment about that from a Canadian perspective. No? No? Okay. Okay, Andrew.
I was just curious. I have a patient that has her bone breaks down faster than it grows, so she's constantly having fractures in her bones. And so I don't know if it was Sam, but she bought some device like $6,000 where she puts it on. Have you heard of that? And then it builds bone.
Yes, that's a bone stimulator, and it has an ultrasound crystal in it. And it's some of the best evidence there is out there that ultrasound works. When people say ultrasound doesn't work, say, look at these bone stimulators, because people are getting better with non-moving fractures. But I don't believe the SAM would qualify with it. Yes?
Regarding the stretch window that you mentioned, would it be advisable then to do the ultrasound in a stretched position and then continue
Absolutely.
stretching as it goes?
Absolutely, yes. If you could put them in a stretched position while you're doing that, that would be really good.
And then to follow that up then, would you be able to combine the SAM with a stretching or specific flexibility program to help with contractures?
That's a good question. They got the intensity so low that it takes a good hour for them to get up to this 4-degree increase. So it could sure be tried. I don't think it would be as effective as traditional ultrasound.
Just one last question before we go for break then. Down here.
No way. This guy's too smart, you know. He has to fly on a 747 just to accompany his brain.
You know about LIPUS,
Yes.
right? Low intensity
Yes.
pulse ultrasound?
Yes.
Maybe I missed it. What's the frequency of sound? Is it, I'm sorry, is it continuous or pulse?
It is continuous. And,
Yeah,
and the frequency is 3 megahertz. They just come out with 1 megahertz. So it's called low intensity therapeutic ultrasound. It is LIPUS.
It's LIPUS, but with some, it's not, it's continuous versus pulse. Because the duration is roughly 2-3 hours. Because over a fractured site, people can wear that during the day and they will be exposed to ultrasound for 3-4 hours.
So you're thinking this might work for them?
Yeah.
Okay.
Thank you, Mark, for that. And we'll take another 5-minute break. And so we'll see you here hopefully in 4. Thanks again.